Esteemed seniors, before your next blood test, stop. These 10 mistakes could compromise your results, delay your diagnosis, and even mislead your doctor entirely. I've seen it time and time again. Smart seniors make avoidable errors and then get told something scary that wasn't even real. So stay with me. I'm Dr. Helen, and today I'm walking you through the most common mistakes seniors over 60 make before getting their blood drawn. And number 9, even some nurses are unaware of it. Like, comment, and subscribe if you've ever had a confusing blood test result. And let's get into it. 1. Forgetting to fast or fasting too long. This is hands down one of the most common mistakes I see, especially among seniors juggling multiple appointments, medications, and routines. Let me explain why this matters so much. Certain blood tests, like those checking your blood glucose, triglycerides, or cholesterol, require you to fast for accurate results. That usually means no food or drink other than water for 8 to 12 hours before the test. Seems simple, right? But here's where the mistake comes in. Some seniors forget entirely and have a quick piece of toast or a cup of coffee with milk, and suddenly the results are skewed. The doctor sees high blood sugar or triglycerides and might wrongly diagnose diabetes or recommend unnecessary medications. On the flip side, other seniors fast for too long, say 14 or 16 hours, thinking more is better. But extreme fasting can stress your body, raise cortisol levels, lower blood pressure, and make you feel faint during the blood draw. It can also temporarily throw off things like kidney function or electrolyte levels. The solution: know exactly which tests you're doing. Confirm with your GP if fasting is required, and if so, aim for the sweet spot, 8 to 12 hours. And remember, black coffee and tea are technically not okay if you're fasting for lipids or glucose, especially if you add milk or sweeteners. Water only. 2. Taking medications that interfere with results. This one's sneaky, and it's not your fault. Many doctors forget to warn patients, and many patients forget to ask. Did you know that some very common medications and supplements can distort your blood test results? Let's take biotin as an example. It's found in many hair, skin, and nail supplements. Seems harmless, right? But biotin interferes with thyroid hormone tests, sometimes making it look like you have hypothyroidism, or that your medication dose is off when you're fine. Anti-inflammatory medications like ibuprofen can affect kidney function markers. Steroids can increase blood sugar and white blood cell counts. Water tablets, also called diuretics, can mess with potassium, sodium, and other electrolytes. Even something as simple as vitamin D supplements can lead to falsely elevated calcium levels if taken right before a test. The tricky part is that many seniors don't consider vitamins as medication, but your body doesn't know the difference. Everything you ingest affects your internal chemistry. What should you do? Tell your doctor and the person taking your blood everything you're taking. That includes prescription medications, over-the-counter drugs, herbal remedies, vitamins and supplements, powders, teas, oils, and even essential oils you consume. In some cases, you might need to pause certain supplements 24 to 72 hours before the test. Always ask first. Don't guess. 3. Not drinking enough water. Let me paint a picture. You show up for your blood test first thing in the morning. You haven't had anything to eat or drink in 10 hours. The nurse tightens the band around your arm, and she can't find a vein. She tries the other arm. She pats your hand. She warms up your skin. Still nothing. Why, you're dehydrated. Seniors are especially prone to mild dehydration. Even if you don't feel thirsty as we age, our body's thirst signals dull, and our skin and veins become less elastic. That makes it harder for phlebotomists to draw blood. And worse, it can affect your results. When you're dehydrated, your blood becomes more concentrated. That can make your hemoglobin, hematocrit, and electrolytes appear falsely elevated. Even your kidney function tests, like creatinine and BUN, can look worse than they are simply because your body is short on fluid. The fix is simple. Unless your doctor has told you to refrain from fluids, which is very rare, you should drink 1 to 2 glasses of water about an hour before your test. Not too much. You don't want to overload your bladder, but just enough to rehydrate your system and plump up those veins. And yes, water only, not juice, not coffee, just good plain water. 4. Exercising strenuously the day before. Yes, exercise is good. I want all my senior patients to move their bodies daily. But what I don't want is you doing a full body weight session the day before your blood test. Why? Because when you exercise strenuously, especially with resistance training, you cause tiny tears in your muscles. That's normal. That's how muscles grow. But it also raises certain markers in your blood, especially creatine kinase CK liver enzymes, like ALT and even lactate dehydrogenase, LDH. If we're testing you for liver function, heart issues, or muscle disease, these markers might raise red flags that aren't real, just your body recovering from yesterday's workout. And if you're already someone who's prone to aches and pains or being misdiagnosed with inflammation or fibromyalgia, these false positives can lead to unnecessary worry or even medications you don't need. So what's safe? Gentle walking, light stretching, yoga, and other low-intensity activities. But avoid weightlifting, long hikes, or any strenuous activity for at least 24 to 48 hours before your test, especially if you're having liver muscle or inflammatory markers checked. 5. Showing up anxious or flustered. Now let's talk about something that doesn't show up in the test instructions, but affects your results. Your emotional state. When you arrive at the clinic, rushed, stressed, or out of breath. Your body is in a mini fight-or-flight mode that triggers the release of adrenaline and cortisol, which can temporarily raise your blood sugar, slightly elevate your blood pressure, shift your white blood cell count, and even impact thyroid levels or heart rate. I once had a patient who ran into the clinic late, flustered from traffic, and worried about being poked with a needle. Their results showed high cortisol and blood sugar. A week later, the same test calm environment. Everything was back to normal. If you're going to take the time and effort to get tested, do it right. Arrive early. Sit for 10 to 15 minutes quietly before the drawing. Breathe deeply. Don't be scrolling your phone, reading scary health news. Let your body come to rest. Think of it like calibrating a scale. You want to weigh your body and your blood at baseline, not in panic mode. 6. Not asking which tests require special prep. Many seniors assume that all blood tests are the same, that you just roll up your sleeve, get the blood drawn, and wait for the results. But let me tell you, some tests require very specific timing preparation or medication adjustments, and skipping those steps can completely invalidate the results. Let's break down some examples. Fasting blood sugar or lipids. Yes, you need to fast. Thyroid hormone levels, no fasting needed, but the time of day matters. Best drawn early morning. Iron studies better in the morning, and ideally not right after taking an iron supplement. Hormone levels need to be checked to determine if you're on hormone replacement therapy or not. Cortisol, or ACTH, must be drawn at a specific time, usually between 7 to 9:30 a.m. due to natural fluctuations. Parathyroid hormone and calcium shouldn't be tested right after taking vitamin D or calcium. The mistake seniors make here is assuming the pathology lab just knows what to do. But if your doctor hasn't written clear instructions on the request form, or if you haven't asked for clarification, you might fast unnecessarily or fail to fast when you need to. What should you do before your appointment? Call your GP clinic or the lab and ask, are there any special instructions for these tests? It only takes a minute and it ensures the accuracy of your results. Don't leave it to chance. You deserve accurate answers. 7. Drinking alcohol the night before now. I'm not here to judge anyone's evening habits. A glass of wine with dinner is common, and I know many of my patients enjoy that little nightly ritual, but if you have a blood test scheduled the next morning, you should skip the alcohol the night before. Full stop. Why alcohol, even small amounts, can raise your triglyceride levels. Temporarily elevate liver enzymes like ALT and AST. Dehydrate. You lower your blood sugar, especially if you're on diabetes medications, and interfere with medication metabolism, leading to misleading lab values. Let's say you have a liver function test. If you had 2 glasses of wine the night before, you might show elevated enzymes, and that can trigger a whole cascade of repeat tests, ultrasounds, and anxiety. Even worse, if you're being screened for metabolic syndrome, the glass of wine might make your blood sugar and lipids look worse than they are. My recommendation: avoid alcohol for at least 24 hours before your blood draw, and ideally 48 hours if you can. It's a small sacrifice to make sure you get clean, honest results that reflect your true health, not a late-night indulgence. 8. Wearing tight sleeves or hard-to-remove clothing. You might not think your fashion choices matter at a blood test, but trust me, they do. When I worked in clinics, I saw it all the time. Seniors in long-sleeved shirts with tight cuffs or layered sweaters are struggling to expose their arms. Some even had to fully undress in the tiny phlebotomy chair. Others rolled up sleeves so tight that they cut off circulation. It causes delays. It increases anxiety. And sometimes it limits which arm can be used, especially if you're cold or constricted. The phlebotomist needs easy access to the inner elbow area, the antecubital fossa. That's where the best veins usually are. And if we can't get to that spot easily, it may result in a painful draw or multiple pokes. My advice: wear a loose short-sleeve top or a cardigan that opens in the front. Make sure your outfit allows quick, easy access to both arms. Comfortable clothing equals smoother experience equals quicker results. 9. Not mentioning hormone therapy. This one is often overlooked, even by medical staff. Your hormonal status affects your blood test results more than most seniors realize, especially as you age. If you're taking hormone replacement therapy, HRT your doctor, and the lab must know that information. Here's why. Hormone therapy affects cholesterol levels. Seniors on HRT may show higher HDL good cholesterol and lower LDL. But if that's not noted, a doctor might think your results are unusually good, or think your medication is working when it's the hormones doing the work. Hormone levels used to assess various conditions mean very different things, depending on whether you're on hormones. Even thyroid function tests can be affected slightly by hormone levels because of how thyroid-binding proteins behave. I once had a patient who got referred to an endocrinologist for abnormal hormone levels, only to realize later that they were still using a transdermal hormone patch that the lab didn't know about. So always mention if you're on HRT, if you've recently stopped HRT, if you use patches, creams, or pills with hormones, even if you think it's irrelevant. It's better to give the full picture. Your blood work doesn't exist in a vacuum. Context is everything. 10. Leaving right after the draw without checking. You got poked. The vials are filled, and you're ready to head out the door. But wait, this is where a lot of errors happen. Too many seniors leave without confirming some key details. Were the correct tests drawn? Sometimes the lab forgets to draw one of the tubes ordered, or a test is missed due to timing. Did they get enough blood? Some tests require specific volumes. If too little was drawn, it might get rejected later and you'll have to return. Did they label it properly? Mistakes happen. It's rare, but I've seen mislabeled samples cause serious mix-ups. Do you know how and when you'll receive results? Is your doctor calling you? Are you expected to check a portal? Should you book a follow-up? And this part is especially important for seniors. If you're prone to dizziness, fainting, or low blood pressure, don't just hop up and leave. Sit, drink some water, let the staff know if you feel woozy. I once had an older patient leave, too quickly stumble in the parking lot, and end up back in the ER, not because of the blood test, but because they stood too fast on an empty stomach. Moral of the story: slow down, ask questions, confirm everything. Your health is worth a few extra minutes.